This is a training video for admitting patients to bed cards on Flow, the electronic whiteboard system. In the past, it was not possible to admit a patient to a bed card on the whiteboard or discharge a patient at times when there was reduced ward clerk cover. This has now changed. During these periods of low cover, staff on wards with Flow whiteboards no longer have to leave a voicemail with details of admissions, transfers or discharges. It is now possible for these transactions to be carried out on the whiteboard. I am going to take you through how to admit a patient to a bed card using this method. I will demonstrate. Click Admit on the appropriate bed card. Click on the appropriate patient from the TCI banner. Now I am asked for the admission details. Enter the date of admission to the ward. Enter the time of admission to the ward using the time selector. This is in 24-hour clock format. In some cases, you will be asked to choose the consultant. Choose consultant by typing some of the consultant's surname into the box. You will see a list of doctors appear. Select the correct consultant. Choose specialty. The default specialty for the consultant will appear. You can change this if appropriate. Click OK. Please note that up until you click OK, if you need to cancel, you can by clicking on the button Cancel. And that is the admission complete. The patient will now appear in the correct bed card. The ward return should still be updated, but the ward clerk does not need to update PAS. I am going to take you through how to transfer a patient to another ward in the same hospital using this method. Click on the bed card of the patient you wish to transfer. Click on the Transfer Request button. You will be presented with a box asking if you wish to transfer the patient to another ward or transfer the consultant. Choose ward. Choose the ward the patient is moving to. Click OK. And click OK on the box containing the transfer details. Please note that up until you choose OK, if you need to cancel, you can at any time by clicking on the button Cancel. The patient will now go to the bed manager's allocation list. When a transfer has been requested, you will see that the transfer icon on the patient's bed card will appear blue. It will appear green once the bed manager has allocated to a ward. Click OK on the patient's bed card to confirm the transfer request. The patient will not be removed from your whiteboard until the bed manager allocates the patient to the receiving ward, and the receiving ward places the patient into a bed card. When you look at the bed card following a transfer request, text will appear above the patient's details to show you the progress of the transfer. I am going to take you through how to transfer a patient to another consultant in the same ward using this method. Click on the bed card of the patient you wish to transfer consultant. Click on the Transfer Request button. You will be presented with a box asking if you wish to transfer the patient to another ward or to transfer the consultant. Choose Consultant. Type the consultant's surname or part of it into the box. Choose the consultant from the list. You can keep the specialty as defaulted or change if necessary. Click OK. You will need to click OK on the bed card to confirm the transferred consultant. Please note that up until you click OK, if you need to cancel, you can by clicking on the button Cancel. You can now discharge patients from the whiteboard using this method. I am going to take you through how to discharge a patient to another hospital, home, or another residence using this method. Please note that it is important for data quality that the correct options are chosen for each type of discharge. I would urge you to listen carefully to this video and refer to the crib sheet on your ward. If you are still in doubt, please ask your ward manager or another member of your team. Ward clerks will also be able to advise. To discharge a patient, click on the bed card of the patient you wish to discharge. Click on the Discharge Patient button. Enter the discharge date the patient left the ward using the calendar button. Enter the discharge time the patient left the ward using the time selector. You need to choose AM or PM. For patients who are being discharged to their own home, please choose the following options. Destination on discharge should be usual residence. Method of discharge, normal. For patients who are deceased, please choose the following options. Destination on discharge should be deceased. Method of discharge should be died post-mortem or died no post-mortem. If it is unknown, please choose died no post-mortem and alert the ward clerk to update this on PAS when known. For patients who are being discharged to another hospital within the Southern Trust, please choose the following options. Destination on discharge, other hospital, general. Discharge destination, please choose the correct hospital within the Southern Trust. Method of discharge should be internal discharge consultant. This means it has been a consultant-led discharge. If you are working on a ward where nurse-led discharges take place, you can choose nurse-led discharge. For patients who are being discharged to another hospital outside of the Southern Trust, please choose the following options. Destination on discharge, other hospital, general. Discharge destination, please choose the correct regional hospital. Method of discharge, transfer, other hospital. For patients who are being discharged to residential or nursing homes, please choose the following options. Destination on discharge, non-NHS hospital or home. Method of discharge, normal. For patients who are being discharged to prison, foster care or temporary residence, please choose the following options. Destination on discharge, choose the relevant option such as prison, residential accommodation or temporary accommodation. The method of discharge for all of these are normal. For patients who have self-discharged or absconded, please choose the following options. Destination on discharge, self-discharged or absconded. Method of discharge, discharged, self or relative. Before you click OK, check the comment field. If it is grey, you do not need to insert a comment. If it is white, please add a little detail about the discharge. In particular, for discharges to nursing homes or residential homes, please use this field to record the name of the home. Or, in this example, I am explaining that the patient left the ward. Click OK. Click OK on the patient's bed card to confirm the discharge. Please note that up until you click OK, if you need to cancel, you can by clicking on the button Cancel. Once you have clicked OK, the patient will be discharged from the whiteboard.